I'm Dr. Horchover, and I've been treating obstructive sleep apnea exclusively for almost 17 years. I'd like to introduce you to the Airway Metrics System for locating the mandible's target treatment position for optimum airway, as well as selecting the starting position and finally obtaining the bite registration at the position of your choice. The protocol is simple, repeatable, and accurate, enables your staff and patients to participate in the process. The three-component system is presented in 2 cassettes plus bite forks and handles. The main system includes a snore screener and 15 mandibular positioning simulators and a broad range of both AP and vertical positions that can quickly provide your selected bite registration position. The vertical titration keys enable you to check the vertical positioning. They function as a shim, and they begin with 3 millimeters up to 11 millimeters that you can insert between the upper and lower unit of any appliance that opens in the anterior. The Airway Metrics System will take you through the identification of mandibular positioning right up to the point of the bite registration and the integrated parts you can use to obtain that registration. So you are going to have the most likely place for your target treatment zone, but at that moment of the beginning you want to find that place that is going to be the most comfortable for the starting position, and you can use one of the mandibular positioning simulators that has proven that it is in a comfortable and a good starting place. So then you verify the midline when the teeth are closed together. If that is difficult the way the teeth are lined up, you can use a little marking pencil on one of the teeth to get a good lineup and then erase that when you're finished. You attach the fork and the handle to the mandibular simulator and fit it between the upper and lower centrals and confirm the midline. And fourth, inject your bite paste from cuspid to cuspid on maxillary and mandibular and let that set. And then you can remove that and trim it and verify the midline. So you now have a very defined index for the anterior teeth. And number 6, after you've trimmed that upper anterior index, you can insert that and have the patient bite into the lower until his closing is smooth. It might take him 3 or 4 times, but he can bite very quickly right to the position that you want to take your final registration in. You have now established with that anterior index that your alignment and position is as you want it. So now remove it, add paste to the posterior portions of the bite fork, and insert it back into the mouth so that the anterior teeth are back into your index for a full arch accurate bite registration. Each of the 2 cassettes includes instructions on how to use the components, and there is a DVD of the entire procedure as well as a movie of the procedure in detail. So visit airwaymetrics.com for more information and ordering. Thanks.